Depression is an illness and needs to be acknowledged as such. It is not a reason to be ashamed. The reason so many people fail to seek help for their depression is that they are ashamed. Unfortunately, this is one of the feelings associated with depression anyway, and makes the illness difficult to acknowledge. If you are constantly feeling particularly low, well-meaning friends might tell you to snap out of it, or even start to get irritated by your mood. Your depression will feed off this negativity and you start to wonder why you can't just snap out of it. You then start to feel that there's something wrong with you because it should be so easy and it's just not right, that you feel so bad all the time. Well, it's not right and there is something wrong with you. You have a medical condition and you deserve treatment in the same way as any other patient. If you had a cold for 6 months, would you ignore it and hope it would pass? No, you would dose yourself up with anything you could find and maybe see a doctor to find out if there's an underlying reason for it to last so long. Depression is sadness that lasts too long. Everyone is sad at some point in their lives, but depression is more than that. It is a feeling that you can't bring yourself up from the bottom. In the end, you give up trying. People start to avoid you. You feel worse. You need to find external help to treat the problem in the same way as you would if you had a long-lasting cold. You could try herbal remedies, there are some in your pharmacy, or you could see your doctor. There may be an underlying physical cause for your depression. If your doctor cannot help you, they may refer you for counseling. Don't be embarrassed to go for counseling, but do make sure you are comfortable with your counselor. If not, try another one. Counseling should not be discounted because you don't feel comfortable with your first choice of practitioner. In everyday life, you will naturally find that you get on with some people and clash with others. You cannot afford to have a personality clash with your counselor. On the other hand, you must be sure that it is a personality clash and not just that you don't agree with what they are saying. A general rule is to go with your instincts. If you like the person and seem to get on well in the first couple of sessions, then stick with it because they might just have touched on the root cause of your problem. In some cases, acknowledging depression may be difficult because you have lived with it so long that you don't know whether it is depression or not. If you have grown up with depression, it is possible not to realize that you are actually depressed because you have no concept of how normal people should feel. You may feel angry all the time, or you may feel like going to the middle of an empty field and simply screaming. You may feel anxious, have trouble sleeping, or even sleep too much. You may think that your family would be better off without you, and actually believe that to be true, and may have considered running away or suicide. You may worry about death all the time, yours or someone else's, and not let yourself be happy just in case, or even, I must enjoy this now in case. If you are feeling any or all of the above, then you need to consider talking to someone. Even if it is just a friend or family member to start with, they may be able to advise you and encourage you to seek professional help. Once you have acknowledged that you have depression, please remember that it is a medical condition and can be cured. You don't have to feel this way forever. Nobody actually thinks of you the way you think they do. Talk to someone. Seek and accept help, and you will find that there is a different way of seeing life. One of the most prevalent health problems in many countries around the world is depression. Indeed, researchers have concluded that a majority of people will experience clinical depression at some point during their lifetimes. As a result, all people should at least have a basic awareness of what different depression treatment regimens are available in the 21st century. Indeed, when it comes to depression treatment, there are a number of different options available to people afflicted with this possibly debilitating disease. If a person is suffering from a mild, isolated case of depression, an effective depression treatment program may include more sleep, an improved diet, and increased exercise. In some instances, a combination of these recourses does result in an effective depression treatment regimen. Many people find themselves suffering through a more serious bout of depression. In such instances, a depression treatment program must include professional assistance. When consulting with a qualified healthcare professional, a depression treatment program that includes therapy and medication or medications is likely to be recommended. When it comes to a depression treatment program, medications are helpful to aid in the reduction of the symptoms that commonly are associated with a depressive illness. With that said, in most cases, it is important that a depression treatment program include therapy. Therapy is an important element of a depression treatment program in many cases to assist the afflicted patient with discovering the root causes of the depressive illness with which he or she is afflicted. In some instances, a depressive illness is so serious that a depression treatment program includes inpatient hospitalization. In most instances, a person who is hospitalized for a depressive illness will only be confined for a short period of time for a matter of days. The goal of hospitalization as a depression treatment regimen in the 21st century is patient stabilization. The long-term treatment will be conducted on an outpatient basis. Long gone are the days, in most cases, in which stabilization and intensive treatment occurs while a patient is involved in an inpatient depression treatment program. In recent years, many mental health care professionals have again begun to advocate the use of EST, electroshock therapy, for patients who have a more profound depressive illness. For some period of time in the 1970s and 1980s, EST as a depression treatment option was frowned upon by a wide sector of the mental health care professional community. However, in recent years, the techniques associated with EST have been refined and many doctors have come to see beneficial results in their patients who are subjected to a depression treatment regimen that includes EST. But, again, EST is utilized as a depression treatment option in only a limited number of cases in which the depression of a particular patient is severe and unabated over an extended period of time. As with depression treatment programs that include medication, patients who receive EST also participate in a course of therapy to try and discover the root causes of the depressive illness.